Okay, so what I'd like to do is just go over with you guys some of the different needles, okay, and syringes, and just so you can become familiar and have a look at sort of how this is all organized, because there is a system to it. All right, so when it comes to needles themselves, what you'll notice on the packaging, so I'll just bring that in a little closer. What you'll notice on the packaging is that there is colors on the packaging. Okay, those colors also too are what are found on the hub of the needle. Okay, so the yellow needle here has a yellow packaging and it's a 20 gauge needle. Okay, as compared to a 25 gauge needle, has a blue packaging and it has a blue hub. These are universal. So you will find that majority, I guess I can't say totally universal, but what you'll find is that for the most part, a 25 gauge needle will always have a blue hub. Okay, and that is just to allow an easy identification and to keep in mind that we want some standardized ways of going about it. So the gauge itself, I'll just bring that 25 gauge needle back. The gauge itself talks about the bore or the diameter of the needle. How this came to be in comparison. So if we look at the 18 gauge needle, what's ironic is that even through the packaging, you can see that 18 gauge needle kind of looks a little bigger compared to the 25 gauge needle. But that sort of seems a little contradictory because you'd think a 25 larger number would be a larger needle. So this is how, when they were actually determining the gauges, this is what they did. They took an inch and they said, in that inch, how many needles can fit in that inch that are that size? And sure enough, it takes 25 needles to fill that. And that's where they have that measurement. And that's where they came across these measurements. So the bigger the number, the smaller the needle. Just so you know, okay? All right. We are looking at here, so this is a 16 gauge. This is for those of you that give any blood or donate blood. This is a 16 gauge needle, and that is one of the larger needles that we will use. This is also to an angiocath, okay? And the angiocath, the design of the angiocath, it comes in different designs, but it typically has a protective covering. And what is really the main feature about the angiocath needle is that so it has the needle itself and then it has the plastic, okay? It has the plastic part which stays in the vein, okay, at the time. So in comparison, this is an angiocath needle, okay, in comparison to what's called a butterfly needle. And I'll just show you the packaging here. So this is a butterfly needle, okay? And as perhaps the name suggests, the butterfly needle has these little wings, okay? It has these little wings. These are more of the types of needles that are used in nuclear medicine, okay? Because nuclear medicine does not give power injections. So we use, in the diagnostic imaging department, often use power injectors to give these bolus injections. So with the butterfly needle, once the needle is inserted, the needle actually stays in place. If we were to use a butterfly needle in the CT department or the ultrasound department, by leaving that in place, so that has no flexibility, like it's in comparison, right? The angiocath, that has no flexibility. This is what's left in place. So this is often inserted, say, into the antecubital space of the elbow there. And if it's flexible, the patient can bend their arms. And in the CT scanner, quite often we need their arms up above their head. So this does not cause damage. The angiocath does not cause damage to the surrounding tissue versus, say, the butterfly needle would. Now, the purpose of the butterfly needle in nuclear medicine is to inject radiographic isotopes. So once the injection is done, the needle comes out. So it's the purpose is quite different, which is why they use a different needle than we do. Okay, so if you hear butterfly, that is what the design of that, and these are angiocaths. Okay, these are angiocaths, which are the most typical ones that we use, and when you do your venopuncture, you will be using angiocaths. All right, the angiocaths, as well as other needles, they come in different gauges, different sizes. We have an 18, we have a 20, and a 25. The standard size that we use in the CT department is an 18 gauge needle and the angiocath. And the reason we use that is because we give injections typically anywhere from 3 cc's or mils per second to 5 cc's or mils per second. So we need a large bore, okay? We need a needle that has a wide or a large bore diameter in order to accommodate that high pressure injection that we give of contrast media. Okay, all right, that is the purpose of that. All right, so we have a few different, as I mentioned here, we have an angiocath, then we have other regular needles here. Something like the 18 gauge here would be used to draw up, medications. Okay, it would be used to draw up medications. However, because it's a large bore, when we actually administer those medications to the patient, we would exchange needles and we use a smaller bore or a 25 gauge needle. Okay, we also have here what's called a spinal needle. And the spinal needle is approximately 3.5 inches, okay, in length. Okay, now you might kind of go, ooh, that's getting a little long. However, if we're trying to freeze an area in the abdomen or in the pelvis, and we want to freeze it deep down in the tissue, we will need access, and that's why we have a spinal needle. Okay, and just because we always have to have the showstopper, there's another needle. It's a 6-inch. It's a 6-inch needle. Okay, and again, that would be used more in special procedures types of exams. It's not typical. All right, what we have here is a whole assortment of different syringes. This one, it's 1 cc or 1 mil. Then we have our 5 cc or 5 mil, and it has your gauge, your increments on there. Then we move up to a 10, okay? And then we have our 20, and then finally we have our 60. Okay, we have our 60 cc or 60 mils syringe. Okay, what I'd like to do is I want to point out here on this particular syringe. So notice the top of the syringe. Notice the tip. Okay, so the tip is what we call, okay, a lure lock. And the lure lock is different from a slip tip. And I'll go into more detail here. Let's make the comparison. Think of a screw and a nail, okay? The lure lock is the screw. It's the most standard type of tip we use for our syringes. The slip tip, as the name suggests, the needle would just slip on. I don't want to open it. Okay, the needle would just slip on, so it'd be like a nail. Whereas the lure lock will be a screw mechanism. So the needle is screwed on. This is from a safety perspective, okay, that the needle is screwed on rather than slip tip. There's times where we use a slip tip, not saying there isn't. When you're looking at the packaging, because it all looks the same, okay, with the syringes, it all looks the same. I'll just bring that nice and close. So can you see lure lock? Luer. Okay, so the lure lock is the typical one that we use. The physician will let you know otherwise if they want a slip tip, okay, or it'll be in their, in the requirements in the book or whatever kind of thing. So there is a difference in the tips, right? And then we have the flanges of the needle, okay? We have the barrel of the needle. We have the tip, of course. We have the plunger. And we have the stopper, okay? And they all serve a purpose, okay? And when these items come, they come in sterile packaging, okay? They come in sterile packaging, all right? It'll say on the packaging, okay? Often it'll even include on a lot of this the expiry date. So please examine the packaging. Keep in mind that packaging can vary. And here's a couple examples. So this type of packaging, this is some sterile gauze. This type of packaging is called paper on paper. Okay? This type of packaging is called paper on plastic. Okay? And then finally, we have this type of packaging, which is plastic on plastic. Okay? Just kind of to bring that to your attention, because when you are accessing these different ones, I would have to say that the plastic on plastic is more forgiving. So you can be a bit more kind of firm when you're handling that. However, as soon as you start getting paper on paper, you need to examine the integrity of that paper because it can easily be ripped, torn, perhaps moisture. Okay, so we always, especially with gauze, we always have a look to make sure that that packaging is intact. Okay, and then as you open it, it's going to have a little bit of a different technique here to it. Okay, just something to kind of keep in mind because we do keep all these supplies in the diagnostic imaging department. Some supplies we ration versus others. So you would hate to kind of grab the last one and then you don't open it properly, kind of thing. So yeah, I just kind of want to share with you some of the different needles, some of the different syringes, because those will be some of the things that you'll be using when we start our venopuncture, etc. Okay.